Guys, my name is Christian Alisabal and I'll be talking about the role of the physical therapist in this pandemic in relation with COVID-19. So the first thing is that you need to know that physical therapists are the ones who work in primary healthcare facilities that will likely play a part in the management of patients admitted to the hospital with confirmed or suspected COVID-19. Because of this, direct contact with patients, physical therapists, and other clinicians are susceptible to the transmissions of this this infectious disease. Physical therapists are also often first contact practitioners, which means that they are in a position to take responsibility for the early identification of this infectious disease and are managing the workload in primary care setting. It is therefore very important for physical therapists and other health professionals to be familiar with the symptoms of COVID-19 and to help prevent its transmission and understand how they can be involved in workforce planning. They must use their professional judgment to determine when, where, and how to provide care, with the understanding that this is not always the optimal environment for care for anyone who will be involved. So at the same time that there are considerations that must be given to the fact that our profession plays a crucial role in the health of our society, and there are people in our communities whose health will be significantly impacted by these disruptions to care. So these are tips on how to avoid the transmission of COVID-19. So in our clinic, we usually do the following, and then the number one is that we would adhere to the basic protective measures at all times, or the standard protocol for COVID-19. Then number one there would be the perform hand hygiene, frequently rub with an alcohol if your hands are not visibly dirty, or with soap if they are visibly dirty. Then you should avoid touching your eyes, mouth, and your nose as well. And then you should practice respiratory hygiene, so by coughing or sneezing into bent elbow or tissue and then immediately disposing of the tissue. Then to promote the respiratory hand and clinic hygiene. So in our clinic, we ensure that you have appropriate written infection prevention and control protocols in your practice setting and communicate these protocols to all staff and co-interns. Then the place additional signage in and around the clinic to encourage regular hand washing. You can get this from the basically everywhere in our clinic because they have alcohols everywhere. So ensure that the alcohol-based hand sanitizers are available at all times. So that is what we do in our clinic. Then we ensure regular cleaning and disinfection of the clinic and equipment, especially after the attendance by a COVID-19 patient or a susceptible COVID-19 patient. And